Welcome to this presentation. I'm Erin Buck, and today I will be discussing pharmacotherapy options and considerations for the treatment of major depressive disorder, or MDD. Depression is an affective disorder characterized by symptoms that significantly impair an individual's daily function and activity. Symptoms may include altered moods or emotional disturbances, feelings of worthlessness or excessive guilt, decreased interest in enjoyable activities, fatigue or loss of energy, sleep disturbances, and suicidal thoughts and behaviors. Numerous theories have been suggested to account for the development of MDD. While the specific etiology remains unclear, Advocat et al. Suggests that MDD is likely the result of multiple interactions between biological, social, and psychological variables that differ among individuals. Thus, treatment for MDD must be individualized for each patient based on consideration of these unique etiological variances. As Lee et al. States, the pathogenesis of depression is complex, and all the hypotheses should be integrated to consider the many interactions between various systems and pathways. Pathophysiological theories on MDD suggest numerous causal factors, including the monoamine hypothesis, the stress-responsive hypothalamic pituitary adrenal axis hypothesis, the microbia gut-brain axis, neuroinflammation, the endocrine system, the neurotropic family of growth factors, and the glutamatergic and GABAergic hypotheses, among others. As no single hypothesis can adequately explain all aspects and circumstances of MDD, connecting research from various theoretical perspectives of etiology can help guide the development of efficacious pharmacological treatment strategies. The monoamine hypothesis focuses on the presynaptic and postsynaptic functions and processes of the monoamine neurotransmitters serotonin, norepinephrine, dopamine, and acetylcholine. The monoamine hypothesis of MDD is a widely accepted model based on the efficacy of antidepressant treatments that promote neurotransmission of these monoamines. The following table lists some classes of drugs commonly used to treat MDD. Recent advances highlight the role of intracellular messengers and neurogenic processes that impact depression. One example involves the stress response, or HPA axis hypothesis. According to this perspective, cumulative effects of wear and tear on the mind and body build up over time to form one's allostatic load. Chronic or prolonged activation of the physiological stress response increases the allostatic load burden and disrupts the body's ability to engage the allostasis process necessary to return to homeostasis following exposure to stress. The result leads to a buildup of neurotoxins that impact the neuroendocrine, immune, and autonomic nervous systems and their associated catecholamines, hormones, and inflammatory controls, resulting in a decrease in resilience that has been associated with the development of MDD symptoms. The effects of one's allostatic load burden accumulate over a lifetime to increase the likelihood of developing MDD with each additional exposure to stress or trauma that triggers this physiological stress response. As Athera et al. Explained, genetic and epigenetic risk factors and protective mechanisms can serve to mediate individual variances in the stress response. This means that certain individuals will be more vulnerable to the effects of stress and demonstrate an increased likelihood of developing MDD than others. GABA is an inhibitory neurotransmitter synthesized from glutamate. As illustrated in the previous animation, glutamate signaling pathways are involved in the stress response, and the resulting GABAergic deficits impede neurogenesis and contribute to MDD. Antidepressant treatment restores balance to the GABAergic transmission for increased stress resilience and reduced MDD symptoms. The neurogenic theory posits that depression occurs as a result of dysfunctions of the neurogenesis process, which involves the brain's plasticity in restructuring itself by generating new neurons and repairing damage to existing cells. Lifestyle factors can increase or reduce neurogenesis and neuroplasticity. Additionally, antidepressant drugs reduce the symptoms of MDD by promoting neurogenesis at the cellular level. Antidepressant drugs have been shown to be a relatively safe and effective option for treating MDD. However, their use can present a range of side effects and risks that vary in severity and impact. As illustrated by the Sequenced Treatment Alternatives to Relieve Depression study, or STAR-D, variations in symptomatology profiles among individuals with MDD pose a challenge to standardized conceptualizations and one-size-fits-all treatment approaches. Thus, careful consideration of the unique variances presented by each scenario is crucial for reducing the risks involved in the use of antidepressant drugs and maximizing the potential benefits of pharmacotherapy for individuals with MDD. One alternative treatment method involves neuromodulation therapy. Several promising research studies on the use of neuromodulation techniques suggest varying levels of efficacy in treating MDD. Examples of neuromodulation techniques include electroconvulsive therapy, or ECT, which has shown significant efficacy in MDD treatment, as well as various forms of transcranial magnetic stimulation. And as I have nearly exceeded that 5-minute mark, I will conclude this video. Thanks for watching.